Member Stony Plain, followed by Edmonton Centre.
Thank you, Mr. Speaker. Mr. Speaker, seniors in my constituency of Stony Plain have raised concerns regarding health services. More specifically, Mr. Speaker, a number of constituents are concerned about the varicella-zoster virus that causes shingles and the cost to get vaccinated. To the Minister of Health, why are the shingles vaccinations not covered for seniors when the cost of vaccination is so low compared to inpatient hospital treatment?
The Honourable Minister of Health.
Yeah, Mr. Speaker, I want to echo my colleague in expressing concern for those who contract the shingles virus. I know my colleague to my left and myself, we both got the vaccine, which we know it's an incredibly painful and difficult disease. We know that the rates for shingle increases with age, and for the general population, we see less than 5 cases out of 100,000 people, Mr. Speaker. For people between the age of 80 and 84, we see 13 cases for every 1,000 people. So, Mr. Speaker, it's a vaccine that we believe will not be effective across.
Thank you. For supplemental.
Thank you, Mr. Speaker. To the same minister, is there any way the cost of shingles vaccinations could be reduced for low-income groups, such as seniors?
Honourable Minister.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. We will do all we can to make sure that those who are in need of vaccinations will get them. It's important that Albertans have access to the things, the health care they need, and we'll ensure they get that.
Final supplemental.
Thank you, Mr. Speaker. Again to the same minister. Would the ministry consider at least waiving the fees for shingles vaccinations if it leads to reduced hospital costs?
Honourable Minister.
You know, Mr. Speaker, we have an immunization committee. They do not recommend waiving the fees or it be publicly funded. You know, it's one of those things that we can cover everything in the world, but sometimes we have to draw a line, and that's where we did.